Hello friends, welcome to my YouTube channel. Today let us learn the formation and relations of portal vein. Before that, let us see what do you mean by portal system. Portal system means a system of blood vessels that begins and ends in capillaries. The system which begins as capillaries and ends as capillaries. So such systems are known as the portal system. There are various portal systems in the body. Today, let us see the portal system in the abdominal cavity. The portal vein is the vein which is present in the abdominal cavity, which collects the blood from the most part of the alimentary tract except the lower part of the anal canal, and which gives blood to the liver. It is about 8 to 10 centimeter long. How it is formed? It is formed by the superior mesenteric vein and splenic vein behind the neck of the pancreas at the second lumbar vertebra. It goes to the liver. So the portal vein is formed here. It goes to the liver, and in the liver it ends by dividing into right and left branches. The portal vein and its tributaries are devoid of any valves. It transports the products of digestion. We have the superior mesenteric vein. Superior mesenteric vein here, the superior mesenteric vein carries the products of digestion, and the splenic vein carries the products of RBC destruction. What are the tributaries of portal vein? Let us see in detail. The tributaries can be formative tributaries. That means how it is formed. So here mainly we have the superior mesenteric vein and the splenic vein. These two are the formative tributaries. Or at the trunk. So this is the trunk of the portal vein. We have the gastric veins are there, right and left gastric vein, and we have the superior pancreatico-duodenal veins opens into the trunk and to the branches. Okay, we have the right branch here and left branch here. To the right branch there is a cystic vein, and another one is the para-umbilical vein. Para-umbilical vein opens into the left branch. And sometimes, that is occasional branches, we have inferior mesenteric vein and right gastroepiploic vein also opens into the portal vein. These are the tributaries of portal vein. So let us see this diagram. You are seeing the abdominal viscera. So here this is the superior mesenteric vein, and here we have the splenic vein, and this is the duodenum, and here comes the pancreas. The neck of the pancreas is removed. Okay, behind the neck of the pancreas at the level of second lumbar vertebra, superior mesenteric vein and the splenic vein fuses to form the portal vein. Okay, here we have the liver, then it goes to the liver and divides into right branch and left branch. Okay, now so here again you can see, here we have the liver. This is the part of the duodenum and the stomach. Okay, when it goes towards the liver, okay, it passes through the right free margin of lesser omentum. Right free margin of lesser omentum. Okay, the right free margin of lesser omentum consists of three structures. What are the three structures present at the right free margin of lesser omentum? We have the bile duct, portal vein, and hepatic artery. These are the three structures present at the right free margin of lesser omentum. Okay, again remember these important relations, how it is related. So we have the portal vein behind. In front of the portal vein we have the bile duct and the hepatic artery. Hepatic artery and bile duct lies in front of the portal vein. That is how the structures present inside the right free margin of lesser omentum. The hepatic artery and the common bile duct lie in the same plane in front of the portal vein, that is at the right free margin of lesser omentum. Remember this concept. Now, again, the portal vein can be divided into intrahepatic part and extrahepatic part. You know, the portal vein after formation, it goes towards the liver and goes inside the liver. Okay, the part which is inside the liver is the intrahepatic part, and the part below is the extrahepatic part. Then the extrahepatic part can be divided into supraduodenum. So here we have the duodenum, supraduodenal, retroduodenal and infraduodenal part. So we have above the first part of duodenum, supraduodenal part, behind the first part we have the retroduodenal, and below the first part of duodenum we have the infraduodenal part. Now let us see the relations of the portal vein. Infraduodenal part means below the first part of duodenum. Okay, and what structure? So here, you know, we have the pancreas. So anteriorly, what structure? We have the neck of the pancreas. And what is behind this portal vein? Okay, so look at this diagram. So here we can see the liver, gallbladder. So I told you anteriorly infraduodenal part is related to the neck of the pancreas, and behind the portal vein we have the inferior vena cava. And to the right side, okay, to the right of this portal vein we have the bile duct. Okay, then what about the retroduodenal? Retro means behind the first part of duodenum. You know, naturally, we know we have the first part of duodenum. Okay, again I told you the structures related. In front of the portal vein we have on the right side bile duct, and onto the left side there is the gastroduodenal artery. So here we have the gastroduodenal artery, and here comes the bile duct. That is the retroduodenal, and come to the supraduodenal above the first part of duodenum. Okay, and the supraduodenal part of the portal vein passes through, I told you, is the right free margin of lesser omentum. Okay, and what are the structures? Anteriorly we have the bile duct and the hepatic artery, and posteriorly we have the IVC and the inferior vena cava and the epiploic foramen. Now that was the extrahepatic part. Now let us see the intrahepatic part. Okay, on reaching the porta hepatis, the portal vein is divided into right branch and left branch. Okay, and the right branch is short and wide, whereas the left branch is long and narrow. Okay, then what happened to this right branch? Okay, right branch inside the liver divides into two divisions, anterior division and posterior division. Okay, you know the right lobe of the liver has got 4 hepatic segments. So here I am drawing the liver. So here we have a line over here. There's a transverse line. We have antero-superior, antero-inferior,
The left branch,
posto-superior and posto-inferior. Okay, so this right branch enters the right lobe of the liver and divides into an anterior division and posterior division. Anterior division goes and supplies these two parts, that is antero-superior and antero-inferior lobe part segment, whereas posterior division supplies the posto-superior and posto-inferior. Okay, so before the division, it gives a small branch for the caudate lobe. Remember, small branch to the caudate process of the liver. And this right branch of this portal vein shows high degree of variations. There is a high degree of variations in the right branch of the portal vein. Now let us see the left branch. Okay, so here, you know, the left branch I told you, that is longer and narrower. Okay, it has got a long course when compared to the right branch. Right branch runs transversely towards the left lobe of the liver. Okay, again it divides into two, anterior and posterior. The left branch is long and narrow. The course is, it runs transversely through the left lobe of the liver. Okay, and again it divides into two main branches. Okay, you know, the left lobe of the liver, hepatic segments, you know, the left part is again divided into medial and lateral area. Okay, so we are having upper medial, lower medial, upper lateral and lower lateral. Okay, so here this particular left branch of the portal vein divides into two. one for the medial segments and another for the lateral segments. Okay, again what happens, each branches for the medial and lateral segment divides into superior and inferior segmental sub-segmental branches. Okay, so here is a superior, here we have the inferior, again another for the superior lateral and superior inferior lateral hepatic segments. This particular left branch goes posteriorly and ends by receiving the ligamentum teres. Okay, and it also receives the ligamentum venosum. Ligamentum venosum. Remember, ligamentum teres and ligamentum venosum opens into the left branch of portal vein. You know, this portal vein enters the liver and divides into right and left branches. Okay, and each branch I told you divides into small branches and finally reaches the portal triad. Okay, in the portal triad, you know, here we have the portal triad, it divides and finally enters into the liver sinusoids and enters into the central vein. We have the central vein here. So here we have the portal triad. Again you can see how it passes through the sinusoids and finally opens into the central vein. So here you are seeing a hepatic lobule. This is a hepatic lobule. Okay, so here also you can see the portal triads and finally here you have the central vein. So we have the central vein here. The central veins fuses to form the hepatic vein, and the hepatic veins goes backwards and opens into the inferior vena cava. Three hepatic veins are there which are formed by the union of central vein. In this diagram you are seeing the portal vein, how it is dividing, okay, and gives tributary or it gives blood to the hepatic segments. Okay, from the hepatic segments the blood is collected by the three hepatic veins and these three hepatic veins finally opens into the inferior vena cava. So here the first diagram you are seeing, this is the portal vein, see how it is dividing, and here in this posterior part you can see how the hepatic veins are draining and finally giving to the inferior vena cava. So here just look at this area or just look at this diagram. Here you can see these are the hepatic segments and where is the location of these particular hepatic veins. There are hepatic veins are present in between the adjacent hepatic segments. You can see the hepatic segments here and these three hepatic veins are present in between these hepatic segments. Okay, so we can say that these hepatic veins are intersegmental veins, intersegmental vein and drains the adjacent part of the hepatic segment. For example, let us see this particular hepatic vein, this right hepatic vein. Here we have the left one and this is the intermediate one. If we see the right one, it drains the area number 7, 6 and also from the area number 8. Okay, so it drains these three hepatic segments. Then what about the intermediate one, which drains the area number 5 and 4? What about the lateral one or the left one? What about the left one? It drains the area number 3 and 2. We have the hepatic segments are there, we have the hexagonal hepatic segments are there, and you know that hepatic segments are not completely separated from each other. Okay, there are some areas they related very close to each other. So because of these reasons, so this surgical resection is not completely possible. For example, if you want to remove this particular segment, okay, it is not possible because when you remove this particular segment, some part of this adjacent hepatic segment can also get removed. So this hepatic veins acts as a surgical line of resection. The portal vein is present behind the first part of duodenum. Okay, it is retroduodenal. So during development, what happens? The portal vein goes behind the first part of duodenum. Okay, sometimes what happens? This portal vein lies in front of the first part of duodenum. Okay, so that is known as a pre-duodenal portal vein. So here in this diagram, we are seeing the portal vein is here. Okay, here is a duodenum. Okay, and the portal vein is present just in front of the portal vein. In that case, what happens? There may be this pre-duodenal portal vein may compress the first part of duodenum. It may compress the first part of duodenum.